Children are not just socially transitioning in school, they're being set on a medical pathway that includes harmful interventions such as puberty blockers, cross-sex hormones, and even irreversible surgical interventions. My name is Beth Serio, and I am the External Relations Manager at Do No Harm. So Do No Harm is a medical watchdog organization, and our goal is to protect the medical institution against woke ideologies that threaten the foundations of our healthcare system. So our issue areas are DEI in medicine and gender ideology for children. Almost 2,000 hospitals across the United States have engaged in some type of child sex change intervention. Pennsylvania, between the years 2019 and 2023, had over 800 child sex change patients across the state, and they submitted more than $6 million in charges to insurance claims. So both in terms of the revenue and the volume of patients, Pennsylvania was very high on our list of states who are engaging in these practices. Not only is CHOP on our Dirty Dozen list of worst offending hospitals throughout the country, it's actually at the very top of our list. Their Gender and Sexuality Development Program has seen dozens of children during the years 2019 through 2023 come through this program. Putting them on a path towards constant medical intervention with experimental drugs has the potential to not only cause devastating physical and psychological effects in the short term, it could render them sterile in the long term. They could be dealing with issues in bone density down the line, neurological complications, and it's hard to even know the full extent at this point of how badly this generation of children who are being given these drugs will be impacted as they grow up. This is happening to children in children's hospitals across the state of Pennsylvania and across the entire country. I think we need to be really clear that the term gender affirming care, it's anything but healthcare. It's the opposite. It is not kind or caring to take a child who is confused and uncomfortable with their biological sex and set them on a pathway that will lead to irreversible and harmful treatments, the ramifications of which they couldn't possibly know at such a young age. A children's hospital should exist simply to protect and promote the health and well-being of children, not to push radical and divisive ideology on the children and on the community.